I'm Glenn McGinnis, and this is Outburst. This week, how much faith do you have in a COVID vaccine?
Like, if there's a vaccine, I have complete faith in it.
Not a lot.
I think that it's going to be a while yet before the vaccine is ready.
Let's put it this way, I won't be one of the first to get it.
But first, as COVID numbers are predicted to expand dramatically across the country, the same thing will go for restrictions put in place in certain areas that are considered hotspots. After almost 1 year of a pandemic, many of us have grown weary about the precautionary measures put in place because of the pandemic, which has a profound effect on the economy and on people's mental health. So what are your thoughts on the rules put in place because of COVID? Our question: do pandemic restrictions go too far?
That's a question that my answer changes like day to day and minute to minute. I think at the beginning, we were fully in lockdown, and I think that was necessary. I think now, I really think that it's time for them to get their together in terms of contact tracing.
Yes, in certain respects, yes. We've got to keep the businesses going. We have to be more careful. You see where these outbreaks occur are normally they're isolated, but when there is a breakout, it's like you heard about a wedding up in Vaughan or something, 44 people out of 100. That's all it takes is the close quarters, somebody there, and they're breathing all over everyone else. So those are the kind of situations where it really spikes.
I like being able to walk the streets. I want to go back into a restaurant. Sure, there's hot spots around, and it should be dealt with, and people should take better care of what they're allowing or doing. But no, I'd like to see the city a little more open. The isolation was getting to me, very much.
The restrictions should have perhaps even been tougher. They should have looked at the trends and not reopened in Ontario. Here in Toronto, the numbers have been very bad. And I think perhaps they might have enforced through fines a little more. Everybody talked about it, but nobody did anything about it. It seemed oppressive to find somebody who was out walking or sitting at a table, but people need to know there are consequences.
Well, I found we went a little far, but we're also in a little bubble that isn't sustainable. I think people have got to start getting COVID here. It's going to happen, and we might not be ready, but I think they might have gone a little too far when they closed off the parks and outside spaces. I think there was no reason for that. People have to be outside and get their vitamin D and keep the businesses going. That's what's got to happen.
And I think Nova Scotians really, dug in their heels and did what they had to do. We had the mandatory masks, so obviously the government did play a factor in why our cases are so low. But no, when you look at the second wave outside of the Atlantic bubble, it's hit big time all over the world, Europe, Canada, other parts of Canada. How can you say the restrictions are too tight?
I don't think the restrictions go too far. I think what is hard for people to process is that each region of the country, and in fact each local area, is a little bit different in terms of what they're experiencing with the virus. But no, I don't think that the measures go too far.
Well, at my age, I would say no. Again, I can't imagine why anybody would not want to try to stop the spread, so that at least here in Nova Scotia, we can live a fairly normal life, maybe not doing some of the things that the younger people especially would love to do, but that's a lot better than being in a hospital bed dying.
No, I don't. Surprisingly, I don't think they go too far. I don't know how serious COVID-19 is. I'm not a scientist, I'm not a doctor, but I'd rather be safe than sorry.
The best thing for us to do is to do everything that we can and make this as short and painless as possible, because no matter what, I think you have to put people's lives first, right? And so whatever that means, obviously I think the economy shouldn't be the focus, and obviously people should be getting help with money and everything like that, and obviously that is an aspect of it, but the most important thing is people's lives. So I think it's definitely, we have to do everything that we can.
I think if we're looking at civil rights, you will find people that say yes, because Obviously, the free will to walk outside without a mask on is something you're entitled to. But I think it comes down to what you're willing to do for the rest of society. And if, as a whole, together we can learn to wear a mask and social distance, I think we're going to see some significant decreases, whereas right now we are experiencing the opposite. So it's not so much to say smarten up, everybody, but a little bit.
No, I think they're not going far enough. Like, you know, there's cases that are resurging because of events, you know, because we're opening a lot of things, you know. Like, I think, you know, if you're in like a small group and you guys only see each other, then like it's fine if you see each other once in a while, but like you still should be social distancing, wearing masks, you know, all that jazz, you know, making sure that your hands are clean, sanitized, you know, yeah.
If you want this pandemic to end, we need to follow the outline of what we've been told. Because this pandemic, I mean, it's been going on for, what, a year now? Almost a year? And it's stupid. It should be done by now.
No, I don't. I think it's a responsibility of all to keep up the protocols that have been done and perhaps even make them go higher if people are not obeying what's already in place.
No. People are still getting sick. So if they put further restrictions on, less people would get sick. We're not so bad here in Ottawa, but we have to worry about everybody coming into Ottawa.
No, I don't think they go far enough, and it appears that the pandemic is getting worse across the country, and not just in Ontario. Ottawa is fairly reasonable right now, but I feel that some of the governments haven't acted quickly enough.
Oh, I don't think they're going far enough, really. I mean, I was just walking up the street here without my mask. I've got 2 masks on me, and I'm not wearing one. You just reminded me. Thank you.
We've seen the federal government roll out billions of dollars during the first wave of the pandemic to help people and businesses keep their head above water. It also helped to stimulate the economy. But allocating money left, right, and center to counter the negative effects of a pandemic can't go on forever. The federal deficit is expected to reach roughly $350 billion. But do we have the capacity to continue with such expenditures? Our question.
Should government spending be increased during the second wave?
That's a good question. I don't know exactly how much has been spent now, but I think they need to just spend, but the economy has to stay open and be able to do this.
I think during a second wave, the government should analyze which economic sectors are affected most significantly, and it may be that they need to retool and focus more specifically on specific industries and sectors that are more hard hit.
I think we need to know how much has already been spent, and I think we have to be informed about that before any kind of decisions about spending more money. I think we've spent a lot more money than everyone thinks we have. I think we're in a bit of a honeymoon phase right now, and I think people need to know if we are going to spend more money, how long is it going to take us to pay that back, and what does that mean? Because it doesn't come for free, doesn't grow on trees. The money is being spent, and it's got to get paid back.
No, I think they've spent enough. Just try and get everything back to normal. The second wave, like, it'll keep happening, but it's not something that there's much you can do against. Like, if you keep the lockdowns going, as soon as you end it, it will come, like another wave will come back. So until there's like a vaccine, then more lockdowns won't really do anything because it's unsustainable.
Again, that's a tough question. I mean, I'm a business owner, and I feel for what businesses are going through. I really feel for that. And we can't have, you know, a majority or large numbers of small businesses shutting down. So if it's in the name of saving small businesses, there is going to be, you know, the other side of this thing. So yes, I would support, you know, government throwing more money in the form of whatever, loans, forgivable loans, whatever, but really in the name of supporting small businesses, which is where all the jobs are going to be after we get through this.
I do think so, because, well, people being stuck at home, I think the police need more money. First responders definitely need more money. The money shouldn't be getting taken away from them because there's a pandemic. They still need their jobs. We still need them here for their protection, their services. So I do think that the government should be funding those more.
In a way that kind of stimulates the economy because there's more money, you know what I mean? So like there are more people, if people get more money from the government, people will be spending money because they have money, you know what I mean? If they don't have any money, they have nothing to spend, they're gonna save it, you know what I mean? You know, yeah, they're gonna use it only for essentials, but like if you have a little bit of excess of money, you're gonna spend it, which stimulates the economy even more.
To a degree, I think as long as they're truthful about what it's all being spent on, as long as the public knows what it's being spent on and what it's going towards, and as long as it's all things in order to actually help reduce the spread of COVID, then yeah, I'm all for kind of let them have the resources, let them deal with it the way they can. I mean, look at New Zealand. It's not to say that they had an abundance of resources, but that's probably one of the best, the countries that handled it the best. Because I believe, I could be wrong, they might have cases now, but for a long time they were caseless. And they just shut down their borders and said no one in, no one out, because we're fine.
No, I don't think so. I don't think so. Well, we're going to run out of dough.
That simple?
That's simple. And then people will go without, you know, and it could be a lot sadder than it is.
Yes, people can't work. There's a lot of people out of work. I'm out of work. And we need money to live. I need to feed my dog.
I think it should be put into areas that maybe they have missed. For example, there's a lot of seniors out there who are hurting right now. There's a lot of young people who are hurting. They've lost their jobs. And the other thing is the rent income. Particularly for small landlords who are basically tied down in Ontario for 2021, and they have not, these people are living just on a bare shoestring. They're not the big multiple corporations that have high-rise buildings or can afford to maybe let a few dollars go out of their pocket.
If they do allow it to be a little more open, then they won't necessarily have to close down or need help. But otherwise, yeah, somebody's going to have to pay for this. You know, we can't completely shut down.
I don't know how we're going to end up paying for this all. That's going to be a terrible down the road for our younger generation. But if that's what it takes to prop us up right now, then I'm all for that. Again, we've got to keep the businesses going. This is one of the things that really irks me about how high our taxes have been for many, many years now. People don't have enough money in their pocket to spend.
Yeah, I think they're going to have some emergency measures for it's funny, the housing market is exploding, but I don't understand how people are financing or paying their mortgages. It seems to me the vision right now is a little too rosy, and that there's a bit of a financial collapse approaching, and I think the federal government has to be ready for that, as with safety nets.
They busted the bank a couple of times so far as I could see. I mean, let's face it, there are people who are collecting money who shouldn't be, and there are others who need it and don't get it. So I don't understand. I think that the economy, the money part of it, I don't understand. So I can't give you an honest answer on that because I really don't know. But I know that, I think that they can't break the bank. Once the bank is broken, that's it. Where are you going to go from there?
In which year did Newfoundland and Labrador join Confederation? 1935, 1942, 1949. 35, 42, or 49?
49.
42?
1949.
49.
1935.
1949.
It is absolutely 1949. Very good.
The province of Newfoundland joined Confederation in 1949. By the 1940s, Newfoundland was in the depths of economic depression and deeply in debt. Joining Canada could help bring back prosperity. and the push to enter Confederation was led by a broadcaster and labor leader by the name of Joey Smallwood. The matter was put forth in 2 plebiscites, and Confederation won by a narrow margin. On March 31st, 1949, Newfoundland became Canada's 10th province, and Smallwood, Newfoundland's first premier and a father of Confederation. Its name was officially changed to Newfoundland and Labrador in 2001.
A lockdown is something that's put in place as a last resort during a pandemic. But shutting everything down could cripple the economy and put the livelihoods of countless Canadians on hold. But for the sake of public health, many people think it's absolutely necessary to do whatever it takes to keep Canadians safe and to bring these COVID numbers down. We took this question to you.
Do you believe another lockdown is the right thing to do?
We've been in a semi-lockdown, total lockdown, orange, yellow, you know, the colors. It's unprecedented. It's something that even the politicians, you know, they don't know how to react. There's no, like you said, there's no right answer and wrong answers. It's intelligent decisions.
Yeah, I do. I wish it was more. The provinces and territories come to a agreement and mandate it right across the country for now.
Yes, I do. I think that our seniors' lives and our vulnerable people's lives and the economy will benefit from a short, sharp lockdown in the long run.
Yeah, I think we needed another lockdown, and I don't think we should have opened the province up as quickly as we did with our Restart Manitoba campaign. But I mean, hindsight's 20/20, right?
I have to disagree on that, just because it's hurting the economy so bad.
That's a tricky question, because if you look at Europe, and I'm from Germany, and they just had a second lockdown, light lockdown, but it hasn't brought the success that they were hoping for. I know in other places, like in Holland, I think it actually worked and the numbers decreased again, so that's a bit tricky. It always depends if people follow those lockdowns, not just the businesses, of course, because that's easier to control, but people in their private environment, if they actually follow those guidelines. So,
I think it also has to do with what is out there for small businesses, because a lockdown could be entirely detrimental to a lot of the small businesses. So what are we doing to compensate for that if there is a lockdown?
If we have to, I think so. If it continues on the track that it's on, we may have to go into another lockdown. And maybe over Christmas or something, because of people visiting, we might have to post-Christmas do something different. And I can see that happening.
I think they're gonna have to continue locking things down, like things like shutting down bars and restaurants, or identifying which specific venues are causing the most spread and locking those down. At the same time, trying to get as much done so that businesses that are able to safely stay open can stay open. So things like requiring masks everywhere is something that they can do to keep businesses open while reducing the spread.
I'm definitely not opposed to it.
Yeah.
Because London, Ontario, Canada is getting worse and worse as it's getting colder, and it would be nicer to get out of the winter in a better position as we're going into it. Not a whole lot of stuff you can even be doing socially right now, so a lockdown in my eyes is not a bad idea.
Mm-hmm. Yeah. I think whatever we need to do to keep people safe, I'm okay with. If we did it once, I think we can do it again, and hopefully come out on the other side of it a bit better.
Our governments are focused on economy, and it is going to probably hurt us later. It's going to hurt us later. So if we lock down, it's probably going to be best for our society in the long run.
The short answer is yes, and I'll tell you why. You just have to look overseas. We have a daughter in Australia. They're living a normal life
because they locked it down, they shut it down right completely out, and they're doing what we used to do. So, you know, if you lock it down, you get rid of it, then you'll be in business, you know. But unfortunately, we missed the curve. We missed that. We should have done that months ago.
I don't believe so. I don't believe it's the route to go. Well, it's hurting a lot of people. Seniors, businesses, everything. It's really devastating in a lot of ways. So I think they could open up and segregate where the infections are taking place and stuff like that, but they know better than I do.
When I walk the streets here in Ottawa and see how many people are not using face coverings even though they're outside, I find that it may be necessary to do further lockdowns. I know it hurts small business, I know it hurts a lot of people, but I don't see any other way of helping to control this until the vaccine arrives. And even with the vaccine, it'll come in bundles, and so some will get it, some won't. And the next round, some will get it, some won't.
Yes. Why? Because I mean, you're seeing just exponential spread, you know, around the U.S. where I'm from, and I think in Canada it's increasing rapidly. I think it's the only way you're going to stop the problem. I mean, I think you have the vaccine in sight, you know, by spring for the larger part of the population. So if we can just get to that point, I think we're going to be okay after that, but I don't think it's worth the risk right now.
Yes, because I think due to the current rise in cases and the rate in which they're rising, I think it's just best to put everyone back into quarantine and let it die out a little bit before we start bringing people back into the public.
And what do you think?
Yeah, I agree. As long as certain sort of establishments can stay open for takeout and, you know, that sort of idea, and we can preserve a small portion of the economy that way, I think it's a good idea. We'll see how effective it is in London, so probably a good idea.
As COVID numbers continue to rise across the country, one bright spot in this whole thing is talk of a vaccine, which many people hope will put an end to this pandemic and bring people's lives back to normal. Some vaccines are touted to be 95% effective with no serious side effects to humans, but Health Canada must first approve it. So, does this make you optimistic? Our question.
How much faith do you have in a COVID vaccine?
Oh, 100% faith in the vaccine. The two that have been announced anyway, Pfizer and Moderna, are both seem to have really good efficacy, and as long as we can get access to it and do it in the right order, give it to people who are the vulnerable populations first and the frontline workers, I think that's the solution, and then we'll get it next summer.
100%. Good at the moment. Yeah, it's looking really good. We've got two now that are looking, I think they said 60 million doses by the end of the year. So that's going to ramp up, obviously, in the start of next year. So for sure, hopefully we'll be back to normal this time next year. We're getting there at least.
Yep. Sign me up.
Sign me up.
Pretty good, actually. I'll be the first to take one, actually. I have faith in our science, and I would not be afraid of getting immunized.
Not a lot. I don't know. I don't. I definitely get my children vaccinated, but I don't feel like, I think it's on the same line for me as a flu shot, and they're not always accurate. So I don't have a lot of faith in that, and I think people are waiting for that vaccine to think that that's going to be the fix, and I don't think that is.
I have a lot of faith in a COVID vaccine once we know it's completely effective. The preliminary data is nice, but we need to have more data, safety data, and long-term efficacy data. But there's no question in my mind that a vaccine will be very helpful.
Every time that news has come out that there's a potential candidate that's testing well, there's always been news quickly afterwards that the government of Canada has secured like X million number of vaccines. So I think because we're a wealthy country, there's a good chance that when one does come about, we're going to be some of the first people to get it. So I guess we're lucky in that regard.
I don't know if I have faith in a vaccine. I have faith in God. But I'm hoping and praying that they've been working together and that it's going to be effective. So I can't say. I'm not going to be running to be the first one to try it, but I do hope, because we need some sort of hope right now in order to go forward.
I got very high faith in it. I believe in science. You know, I think they're going to do the right thing. I think most of the people involved around the world working on a vaccine are dead serious about their business and are apolitical, and they're going to do the right thing.
There's been a lot of research done over the past 7 months, so I think that if the right clinical testing is done, then I'd have pretty strong faith in a vaccine.
Okay, and what about you?
Yeah, 100%. I think a lot of manpower and collaboration went into this vaccine, a lot of funding, and so yes, like some people are a little bit more hesitant because of how quickly it came out, but I think it came out quickly because there was just so much rallying behind getting a vaccine out. And so I have a lot of faith in it. I'll get it as soon as it comes out.
And let's put it this way, I won't be one of the first to get it. And I would like to see how it works before I take it personally.
I'm not sure. There's a lot of doubt in my mind because I rushed it so much. I don't think I'd take it for a little while, but I'm in the age group that I'm at risk. So, but I'm a little intimidated by taking it right away.
Well, I'll certainly take it, and I would trust that, you know, when it's time for us to have the vaccine, that they will have trust the medical doctors that it's going to be safe. So in that response, I'll say yes.
Like if there's a vaccine, I have complete faith in it. Like I'm sure there will eventually be a vaccine. I'm not super optimistic that it's going to be done by April or whatever like they're talking, but once there's a vaccine there, I'm going to get vaccinated.
I think that it's going to be a while yet before the vaccine is ready. I'm definitely pro-vaccination, but it's going to be a while yet, so we have to be very careful and take precautions right now.
I think it's going to happen, but I have no idea what the effectiveness will be. And so I kind of try to have this open-ended, open hands in my mind to go, okay, it might work, it might not. We might have to adapt for a long time until either the vaccine is successful or it somehow runs its course like the Spanish flu did.
Thanks for watching this episode of Outburst on the Cable Public Affairs channel. I'm Glenn McGuinness. If you have any comments about this show or any other show, you can find us on social media. You can also find us on our website at www.cpac.ca. It's your turn to speak up, and we're listening.